is that we now in 2018 believe that food poisoning triggers this change in the microbiome we call SIBO, which is in essence IBS to some extent, that the toxin cytolethal distending toxin creates this autoimmunity to vinculin. This changes the nerves of the gut. Breath testing and culture are proving that this is in the sequence of what this event, this first food poisoning event, triggers. So again, we're going to focus first on the breath testing because that's where it started, the breath testing culture and all that, and what substantiates this connection between the gut bacteria or SIBO and IBS. So that's where we're going to start. I tried to create this year some fancier graphics. You'll see some of those as we go through, but a little more clear to see. But the small bowel is 15 feet. When it gets distended, believe me, you will know you're bloated. When the colon gets distended, because almost half the colon is behind the cavity, it's called retroperitoneal. If it dilates, you don't get protrusion of the abdomen. So this notion of bloating being caused by colonic gas never quite added up because this thick membrane overlies most of the colon. So the colon can't really cause protrusion of the abdomen like the small bowel can. But the small bowel is 15 feet long and it generally has no bacteria in it. And we've been kind of discussing this over the years that the number of bacteria in the small bowel should really be about 1,000 per milliliter. That's okay. Anything less than that is okay. But the colon, half the weight of stool is bacteria, or 10 to the 12th, and you can do the math, but it's a lot of bacteria there. And people have focused on looking at the stool, and I'll get into why that's a problem later. Everybody and patients get this confused. Doctors don't know how to kind of settle this in their mind. So is it really IBS or is it really SIBO? And the way I'm handling this now to make it very clear for people is SIBO is what's happening. IBS is the disease. So it's like saying you have ulcers, but the ulcer is caused by H. pylori. It's not H. pylori disease, it's ulcer disease. The reason I say that is because SIBO can be caused by many things, as you'll see in the next slide. And so we don't want to say SIBO equals IBS because SIBO could be adhesions or it could be something else. SIBO is the downstream event that causes the symptoms. But what caused the SIBO? That's what we're trying to get a handle on. Why does this SIBO occur? And if we know that, we can cure it. But there are different causes of SIBO. So that's why on this slide I say not all of SIBO is IBS and not all of IBS is SIBO. But we're seeing that 60+% of all irritable bowel syndrome patients, particularly the diarrhea type, are SIBO. And that's really important because we're finding the major cause of irritable bowel syndrome, and it is SIBO. But why? I already mentioned that IBS is the bulk of SIBO, but there's a lot of other things that can cause SIBO. Somebody on morphine for 2 weeks, a normal person, this was done in the 1990s, you get SIBO. So the opioid epidemic that we're having in the United States, all of those people who are on opiates develop SIBO and they get bloating and distension. Of course, constipation is a side effect. Adhesions, pseudo-obstruction, diabetes, a very common cause of SIBO. In fact, we just did an analysis of all the breath tests we've ever done, and diabetes is a clear risk factor for SIBO. And we know that. Two reasons. First, diabetes impacts the nerves of the gut over time, just like it impacts the nerves of your feet, and you get that neuropathy when you get really long-term, poorly controlled diabetes. So the gut is affected, but also gut loves sugar. High blood sugar means high sugar everywhere, and high sugar everywhere means bacteria are very happy. So all of that probably contributes to the development of SIBO and diabetes. And then there are other minor or less common conditions. And I know there's a lot of questions these days about Ehlers-Danlos syndrome because it's increasingly milder forms of EDS and not the old textbook, really hardcore forms. And these milder forms may be part of the problem as well, or part of the SIBO, recognizing of SIBO. But when you go back to IBS again, IBS breaks down into really IBS-C, IBS-D, and IBS mixed. But I'm going to try and argue that there really are only two categories. There's the mixed and D. And this is based on that IBS is an autoimmune disease because IBS-C doesn't appear to be autoimmune. It appears to be a bloom or an increase of methane organisms, methanogens. And we'll touch on that later. But the IBS mixed and D, they have these antibodies, and we think they stem from food poisoning. So really, we're capturing M and D based on the origin of the illness, which is food poisoning. So M and D, food poisoning. C, not, and maybe it's just the methanogens. So basically,